everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. So let's talk about the pressures that actually exist in LGBTQ community and how to be very mindful and careful with those pressures. Let me explain what I mean. A lot of people actually commented on some of my videos saying that they feel incredibly pressured, especially this is going to be relevant for people who identify as non-binary, really pressured into studying hormones or undergoing any kind of surgical interventions. And I get that. I get that when we become aware about our sense of identity, especially in relationship to gender, especially if you identify other than trans-binary, right? Especially if you're somewhere in the middle of a spectrum. It can be very challenging because you don't really have a sense of community. You really don't have a sense of belonging. So as a result, because for all social creatures, it's only natural for all of us wanting to be part of a pact. And we have to be careful and mindful about wanting to be part of a pact. Reason being is because being part of the pact carries its own dangers. And one of the dangers is conforming to the peer pressure of the pact. It's very easy to get seduced by what commonly majority of people in a group are doing and to start believing that what they're doing is the right way and your way is the wrong way. And before you know it, what's happening is that you're pressured to do something that maybe is not in your best interest. Now, in no way am I saying that some of you should not go into medical transition or surgical transition. That is a choice. And as you guys know, I'm always a huge advocate for body autonomy and for you having your own rights. What I'm not a proponent of is especially groups of people where there's mutual consensus that if you identify a particular way, the next natural step is hormones, or the next natural step are surgeries. Remember, transition is highly individualized, and what's really fits in the mold for somebody else is not something for you. For somebody else, it might be appropriate to start hormones, especially if they're trans-binary. For somebody else who may be identifying as non-binary but a little bit more on the masculine side, it may also make a sense to microdose. For somebody else, it may not make any sense to microdose because the changes you want are not necessarily changes you may get, or you may get those changes in a combination with other changes you may not want. So just because you're not taking hormones but you identify as transgender, regardless where you fit on the spectrum, does not make you any less trans. It does not invalidate your own past. When we are starting to be pressured, right, to conform to what majority of the group is doing, what's happening is that you guys don't realize this, but what's happening is that by becoming aware of your gender identity, but yet by conforming to majority of the group, in essence, you're then losing your sense of identity yet again. Because if you're going to be mimicking and copying what this and this person is doing over there, then you're no longer being true to yourself and being true to what your needs are. And that's very important. It's very important for us, just as individual spirit, not to get into this assembly line of identity, right? And what I mean by that is that this assembly line of everybody doing the same thing because they believe that's the right thing to do. It's very important to practice discernment and to ask yourself, what is important to me? What is my relationship to my gender? How do I see and define gender for myself? What feels affirming and right for me? Very, very important, especially when it comes to medical interventions. Why? Because there's irreversible changes. And nobody wants to get stuck with those irreversible changes. When I see a lot of younger YouTubers who transitioned and detransitioned, my heart goes out to them. And I think that happened for a lot of reasons. I think that happened because people don't have time to really explore themselves and to safely explore their gender before jumping in the medical and hormonal interventions. I also think that it's happening because there's tremendous amount of peer pressure. There's also a lot of social pressure. And when you see everybody transitioning, it's hard not to think that that's the right way. And so my heart goes out to them when suddenly people realize that, this really was not for me, it doesn't feel right. So again, it's very, very important not to give in to pressure of groups or what other people are doing. Ask yourself, what do I want? Make a list. Try to see if you can sit down and make a list. What is important to me? What am I ready for? what is important for my gender identity? Can I do those things in a safe manner first to further affirm it for myself? And then only then move on to this other much more serious interventions. Again, in no way am I trying to stop you from getting the interventions you need, both medical and surgical. I'm all for them. This is why I provide evaluation for trans communities, those letters you need to grant you approval from insurances. I provide them all to California and Florida residents for free. Sorry, everybody else, this is just simply licensure rules, because I know that this is one of the biggest barriers. But having said that, I also see a lot of people who are being pressured into stuff and being pressured into especially studying hormones, because somebody is saying, oh, you're not on hormones, you're doing something wrong. And that's not the case. Only you, and you know what's right for you, not somebody else. So be careful with that. Comment below if this is something you struggle with, if this is something you came across with, if this is something that you felt seduced by when you were in a group dynamic, and share what was your experience. I bet this is something that common, especially happens with people who are younger, but don't be an assembly line. Be yourself, be true to yourself, don't be like somebody else. Otherwise, it's like I said, it's like gaining your awareness of your gender identity only to lose it again by trying to mimic somebody else. So hopefully this is helpful, and I'll see you guys all next time. Bye.